I mostly refer to trauma as a deep wound that can affect people emotionally, mentally, and physically. Trauma is also an experience that overwhelms a person's ability to cope and can cause lasting negative effects on an individual's mental and physical health. Hi, I'm AC Hartwell, a licensed clinical health psychologist, and I make mental health education videos. So today we'll be having a deep conversation on the topic of trauma and how it affects us. We equally discuss the triggers, coping strategies, and treatment options for trauma. So stay tuned to the end of this video to gain an in-depth understanding of this topic. Before we begin, let me clarify that trauma is not just an event, but rather the impact of the event on a person's brain and psyche. Thus, trauma can be caused by a wide range of events, including physical or sexual abuse, natural disasters, car accidents, or even military combat. One of the important things to understand about trauma is that it affects everyone differently. While some people may experience trauma and recover quickly, others may struggle for years or even a lifetime. The impact of trauma also depends on several factors, such as the severity of the event, the support the person receives, and lastly, the person's coping mechanism. So, what could trigger trauma? When we talk of triggers, we are referring to specific events or situations that can evoke memories of a traumatic event and cause a person to experience intense distress. This distress could hinder the person's daily functioning. It's also important to note that triggers are different for each person and can vary depending on the type of trauma an individual has experienced. Now, let's discuss some common triggers of trauma. The first is sounds. So, certain sounds such as loud noises or sirens can trigger memories of a traumatic event for some people. An example would be, say, if someone was in a car accident with a loud horn, the sound of a car horn can evoke memories of the accident and cause significant distress to that person. Another trigger could be, say, visual cues. So, seeing objects or places that are similar to those associated with the trauma can trigger memories and cause significant distress for some people. An example of this would be, say, if someone was traumatized by a specific location, seeing a picture of that location or visiting that location may trigger memories of the traumatic event. The third trigger could be thoughts or memories. This means that thinking about a traumatic event or having intrusive memories can be a trigger for some people. For instance, if someone is reminded of the traumatic event by a news story or, say, a conversation, they may experience distress as a result of that. Another trigger could be anniversaries. Dates or anniversaries associated with the traumatic event can be triggers for some people. For example, if someone was traumatized by an event that took place on a specific date, the date may evoke memories of the traumatic event and cause significant distress. Another trigger could be situations. So, certain situations such as crowded or confined spaces can trigger memories of a traumatic event and cause distress in some people. For example, if someone was traumatized by an event that took place in a crowded or confined space, being in a similar situation may trigger memories of that traumatic event. Other triggers of trauma could be physical sensations or even smells. So, what are some of the negative impacts of trauma on an individual? Well, the effects of trauma can be far reaching and can impact a person in many different ways. So, let's discuss some of them. The first will be emotional distress. So, trauma can cause intense and overwhelming emotions such as fear, anxiety, anger. These emotions could be intense and persist even after the traumatic event has taken place. Another effect of trauma will be resulted in mental health problems. So, trauma is often associated with an increased risk of developing mental health problems such as post traumatic stress disorder, which we often call PTSD. It could also result in anxiety disorders or even depression. PTSD is a mental health condition that develops after a person experiences a traumatic event. People with PTSD may experience symptoms such as intrusive thoughts and memories of the traumatic event, avoidance of the reminders of the event, and increased anxiety and irritability. The next effects of trauma is flashback and nightmares. Trauma can trigger memories of the events leading to flashbacks and nightmares. It's important to note that for people who have experienced, say, severe traumatic events, flashback can feel real and intense and can cause a person to feel like they're actually reliving the traumatic experience. Nightmares can also be vivid and frightening and can make it difficult for the person to get, say, a good night's sleep. Another effect of trauma will be consistently experiencing physical symptoms. Thus, trauma can cause physical symptoms such as headache, stomach problems, fatigue, and even muscle pain. These symptoms can be related to stress and the physical effect of trauma on the body, such as increased levels of the stress hormone. Substance abuse can also result from traumatic experiences. Many people who have experienced trauma may turn to drugs or alcohol to cope with their emotions. It is sad to note that substance abuse can provide temporary relief from emotional pain but can lead to addiction and even make it more difficult to overcome the effects of trauma. In some cases, substances can even cause or worsen the mental health condition and have negative impact on the person's personal and professional relationship. Disrupted relationship is another effect of trauma. Trauma can make it difficult for individuals to trust others and form healthy relationships. This could lead to isolation, loneliness, and difficulty in personal and professional relationships. People who have experienced trauma may also struggle with intimacy and may avoid close relationships for fear of being hurt again. The final common effect of trauma I would like to discuss is impairment in daily functioning. Trauma can also impact a person's ability to function in daily life. This can include difficulty with concentration, sleep disturbances, and problems with memory and decision making. People who have experienced trauma may also struggle with work and daily responsibilities and may feel overwhelmed by even simple tasks. So, how can one overcome psychological trauma? The first and most important step is to seek support. One of the steps in overcoming trauma is to seek support. Talking about your experiences with someone you trust can help you process your emotions and feel less isolated. You could talk to a mental health professional or a trusted family or friend. Another step would be to process your emotions. Processing your emotion is an important part of overcoming trauma. This can include journaling or even talking with a therapist to design activities that are tailored to your specific needs. It's important to allow yourself to feel and express your emotion, even if they are difficult. This can help you understand and process your experiences and begin to heal. Working with your therapist who specializes in trauma can be an effective way to overcome trauma. Therapies such as cognitive behavior therapy, eye movement desensitization and reprocessing, we call it EMDR, and trauma focused therapy can help you process your emotions, change negative thoughts and beliefs, and develop healthy coping strategies. Another important step is to give yourself time. Overcoming trauma takes time and it's important to be patient with yourself. It is normal to have ups and downs and to experience setbacks, but with time and support, it is possible to make progress and begin to heal. A combination of medication and therapy can help manage the symptoms of trauma and improve overall well-being. That will be all for today. I hope this video has been helpful to you. If so, hit the subscribe button, subscribe to my channel, and share with others for more educative videos on mental health.